Welcome back to the What's in Your Head podcast, Tools for Pain and Dizziness. I'm Pete Schultz, Doctor of Physical Therapy. Before we begin, please remember that this podcast is for educational purposes only and is not intended to replace medical advice from your healthcare provider. Today's episode will be a short, guided somatic tracking exercise. Somatic tracking is a technique used for pain reprocessing therapy and other mind-body approaches. The goal is not to force anything or convince yourself that nothing is wrong. Instead, somatic tracking teaches you to observe sensations with curiosity rather than fear. When people experience persistent pain, dizziness, headaches, or other symptoms, the nervous system could become overly protective. The brain begins to pay extra attention to sensations and sometimes interprets them as more threatening than they actually are. Somatic tracking helps teach the brain a different message. Instead of saying there's something wrong, we say, I notice this sensation and I am safe. Over time, this can reduce the danger signals surrounding symptoms and help calm your nervous system. So let's begin. We're going to start a 5-minute somatic tracking exercise. And this somatic tracking exercise could be for any sensation you're feeling in your body, whether it's pain or dizziness or it's any other uncomfortable sensation. You could do this exercise sitting, standing, or lying down. So let's start with taking some deep breaths. So take a deep breath in through your nose, and then a long breath out through your mouth. And on the next inhale, I want you to breathe in to the area of the discomfort. So you're breathing into that area that's uncomfortable, and then you're going to have a long breath out. So when you breathe in, you want to feel like all that air is going directly to the area that's uncomfortable. And then when you breathe out, you want all that air coming out of that area. I want you to picture that you're in a dark room and there's a spotlight over the area of discomfort. And on the next inhale, you're going to breathe in and that spotlight's going to get a little bit larger. And when you exhale, that spotlight is going to get a little bit smaller. And remember, we're breathing nice and slowly. So on the inhale, that spotlight gets larger. And on the exhale, that spotlight gets a little bit smaller. And now keep breathing at this pattern. And I want you to focus all your attention on the area of discomfort. And you're watching it. Note the quality of the sensation. Is there pain there? Is there tension? Is it throbbing? Is it burning? You're just watching this sensation with curiosity. Almost like you would watch the clouds in the sky, or you're a scientist observing these sensations and you're just watching. You're watching with curiosity. We're not judging the sensations. They're not good or bad. Not even trying to get rid of them. You're just observing them. You're observing them with curiosity. And we're going to keep breathing in. Watch that spotlight expand. And then you're going to do a nice slow breath out and watch that spotlight get a little bit smaller. Again, we're just watching these sensations with curiosity. Oftentimes, when we have pain, especially chronic pain, we try to ignore or distract ourselves. And sometimes that's not the best way to go about it. And instead, with somatic tracking, we're going to focus on those sensations, or we're going to watch, and we're going to tell our nervous system and create safety in the nervous system. So now on this next breath in, I want you to think about the word safety. So you're breathing in safety. And when you breathe out, think about breathing out the worry and fear and danger. So every breath in, we're breathing in more safety. And then when you exhale, we're breathing out the danger, fear, and worry. And let's do this a few more times. Now we're going to try to continue to breathe slow and create some safety in your nervous system. Now, hopefully, you've all been here, you're listening to this podcast and this somatic tracking exercise, so you're working really hard. You're trying to get out of the uncomfortable sensation. You've been going to the right doctors or the right healthcare providers. Hopefully, you've been exercising, trying to watch your diet, doing all the steps to make yourself healthier and take the steps in to try to get rid of this uncomfortable sensations. So we know we're safe. You've had some imaging or x-rays or MRI, and there might just be some normal structural damage or some small things going on that don't necessarily correlate to the intensity of your symptoms or discomfort. So just knowing as we're inhaling and exhaling, we feel safe and the body is safe and we're in a good place. So let's continue to breathe in and feel safety. And then exhale and try to blow out all the danger and worry. And again, this somatic tracking exercise is really geared towards focusing on these sensations and telling yourself that you're safe and proving to the nervous system that you're safe. You might have gone on a really nice walk, or you might have done a run, or you might have gone to the gym a few times during the week. So just looking at things that have been going on in your life that have been positive and thinking about those things are going to be helpful in this time. So let's do a few more deep breaths. And we're going to breathe in, thinking about thoughts of safety. And then when you exhale, just trying to relax your shoulders. Relax your shoulders, relax your body. And we'll do a few more breaths. So again, your eyes are closed, you're breathing in, thinking thoughts of safety. And then we'll exhale, trying to relax the body. And let's do one more deep breath. And then you could open your eyes. Thanks for joining me for that short somatic tracking exercise. And you could go back to this recording at any time and use it for anything that feels uncomfortable. And the goal is really to get good at this on your own and be able to do some somatic tracking whenever you have an uncomfortable sensation. And sometimes you might use this tool for 1 minute, or you could do it for 10 minutes, or you could listen to a recording like this. And the goal is whenever you feel any uncomfortable sensation in your body, you're going to observe it with curiosity and not judge it, and try to create some safety in your nervous system. And there's a lot of ways to go about doing this. So hopefully everyone enjoyed this episode and enjoyed this somatic tracking practice. Again, come back to it whenever you feel like you need it. And I'm glad that you got something out of this podcast today. If you found this helpful, please subscribe, and you could leave a review or share it with family or friends that are experiencing uncomfortable sensations or pain. And if you want more information about pain and dizziness, you could go to painanddizzy.com. Or if you want to set up an appointment for a physical therapy evaluation or session, you could go to dynamicsportspt.com.